probably have symptoms in patients' histories of study overload, you will probably want to do a physical exam for signs of being a med student. You will want to start with a general inspection of the patient. As you can see here, we have a student who has finally entered the 3rd year and is about to sit their first progress test. You'll be looking for signs of nervousness, irritability, a frightened look on the patient's face, signs of weight gain from stress-eating GYGs, grey hair, balding, and the patient is oftentimes dressed inappropriately. Next, we will start with an examination of the hands because that's the only part of the OSCE that I can remember how to do. We'll start by holding their hands because they probably haven't had human contact in a long time. Now stroke the hand, and the other side for good measure. You may notice clamminess and/or sweatiness. Do not panic, you can wipe your hands on the patient's clothing afterwards. Do a quick check of the nails for nail biting, or in severe cases, entire loss of fingers. Palmar erythema indicates they have been slapping themselves in the face to remain conscious. Now ask the patient to do their best zombie impression. This has no purpose, but is funny to laugh at. I'll now place a piece of paper on the top of the patient's hands. This has 2 purposes. The shaking indicates nervousness, and the paper gives a use to the worksheets given out in clinical skills. Here I would like to take a pulse to ascertain if in fact they're dead inside. This test is inversely proportional to the amount of Supernotes used. While you are waiting for a reasonable amount of time to pass so that it looks like you actually took a pulse, a good question to ask is, when was the last time you consumed a liquid other than coffee or alcohol? You will find that most patients cannot remember this far back. I will now provide a copy of an ECG to remind you that this is something you should know how to read. It is fun to trigger your patients with comments such as, exams are 2 days away, or they raise the sum of minima to 80%. Such statements are typically followed by crying, bargaining, anger, and a frightened expression. We will now examine the patient for signs of sleep deprivation based on the speed at which they can follow your finger. A fun way to relate this to the patient is to tell them, this is your pre-med grades, this is your grades now. Watch the patient's eyes drop just like their hopes and dreams. This is how close they are likely to be to a nervous breakdown at this point. To comfort your med student and put them at ease, it may help to stand behind them, because med students are used to being looked down upon. From this position, you can also observe the fleekiness of your patient's eyebrows. If they start to resemble John Howard's, it is indicative exams are likely only hours away. To finish off, check the lower limbs, which may exhibit signs of erythema indicative of carpet burn from hours spent praying for mercy and good grades. If the patient does start to indeed exhibit 4 or more of these signs, they are probably a med student and their prognosis is terminal. Provide your condolences and refer them to palliative care. Thank you.